Last week, the Department of Health and Welfare sent a memo to doctors who treat Medicaid patients. What the state pays you to cover those costs will be reduced by 4%. The memo says it's because of the state's Medicaid budget is now projected to balloon more than double what was thought it was going to do during the legislative session when the health and welfare budget was set. At the time, the Division of Financial Management thought the growth would be about 8%. They're learning now it's more like 19%. So the DHW is making a course correction before things get too far down the road. Now, Medicaid is mostly paid for by the federal government, but the state of Idaho kicks in about a third for traditional Medicaid coverage and about a tenth for Medicaid expansion. For some perspective on that, that would be about $3.4 billion from the feds and a skosh shy of $1 billion from Idaho. The increase in the budget projection, according to the Idaho Hospital Association, is due to more people going to the doctor, both because our population has increased and need. Going to the doctor is a good thing. A lot of them, though, are using Medicaid to pay for it. But now Medicaid providers are being told to expect a 4% cut to that reimbursement. It's worth pointing out, despite the bold type in the memo that was sent out saying these cuts are coming September 1st, it still has to go through a public comment period and also get the final approval from the Centers for Medicare and Medicaid Services. And when we asked DHW today, what happens if it's not approved and these rate adjustments are not implemented? We were told, quote, service cuts would be needed, to stay within our budget. A follow-up question of what do you mean by service cuts? Well, that went unanswered. But we did get some questions answered by the Idaho Hospital Association, who represents 53 hospitals across the Gem State, from the small Cascade Medical Center to the entire St. Luke's Health System. And they told us today, while they appreciate action being taken now before the situation gets worse and those cuts have to possibly go deeper, absorbing a 4% cut, that won't be easy.
Our hospitals are going to have to make tough decisions, and some of them are going to be able to deal with a 4% decrease easier than others. And I think it will be most difficult for our small rural hospitals.
In what way?
Some of our hospitals, right now, about 50% of our hospitals are operating at a less than 1% margin. Some of them are operating in a negative margin right now. So every percentage counts, every percentage point. So suddenly reducing Medicaid reimbursement by 4% will have an impact.
Are we looking at staffing cuts? Are we looking at services being cut?
Staffing cuts are always the last thing you look at because those are the folks that provide care. And we struggle in Idaho to keep healthcare workforce. We're already kind of understaffed in many areas. So staffing rates, that would be probably last on the list, but they'll have to look at services as well. I think right now the most vulnerable places you'll see as far as potential service line cuts are labor and delivery services and behavioral health services. Those are areas that already operate at a negative margin in most cases, and hospitals continue to provide those services because the community needs those services. But if they have to continue providing those services at a loss, and now the loss is going to be 4% greater, they're going to be faced with some tough decisions.
If that isn't implemented, or if it isn't approved and these changes, this rate change isn't implemented, I was told services would have to be cut. Do you have any idea what that would be?
Well, I don't want to speculate what they have in mind, but the services that can be cut are what are considered optional services. On the optional services list are things like vision, dental services, physical therapy, some prescription coverage, occupational therapy.
I guess bottom line is, given this memo and this 4% cut, how big of an impact will this have?
I don't know that this 4% cut is going to be the most impactful thing. We have so many things coming down the line right now. We have a bill from Congress that just passed that is going to have an impact on Idaho. We have insurance premiums increasing, which is going to have an impact on Idaho. We have approximately 75,000 Idahoans who are going to move in to the ranks of uninsured because of the bill that passed in Congress. So it's not that this 4% cut is going to close hospitals or cut services, but the combination of things, is becoming more and more difficult to absorb.
Just one more thing, though.
Yeah.
Yeah, death by 1,000 cuts, as they say.
Yeah, it's just, I don't know how much more, particularly our small hospitals, can take. I don't know where the tipping point is going to be. This is a Medicaid budget issue. But if hospitals close services, they don't just close for Medicaid patients. They close for all patients.
And this may not be the end to the medical care cuts coming our way. Earlier this month, it was reported House Republicans are considering another reconciliation bill in Congress that could claw back money already allocated. Again, Tony told us today it could include cuts to Medicare, not just Medicaid, but Medicare. We got a similar sentiment from the Idaho Medical Association today, similar to what the Idaho Hospital Association told us. They reiterated some doctors are already at a tipping point and could be forced to cut hours or staff. And if this happens, Idaho Medicaid patients will face an access to care crisis, according to Susie Keller. So how close to a tipping point are we? Well, the Idaho Medical Association told us there's an industry standard, a recommendation that hospitals have enough cash on hand to cover 200 days in case they have to weather a crisis. Of the 53 hospitals they represent, one of their hospitals had less than 2 days cash on hand. 3 or 4 had less than 30 days. And 11 hospitals of the 53 didn't have enough cash to get them through 100 days. By the way, the public comment period on this 4% Medicaid cut, that's open right now, this week. And you can add your 2 cents at the email that is on your screen. That's mcpt@idhw@idaho.gov, which we will include that website in this story at ktvb.com.